Prenatal care is an encompassing change in a person's life in that it involves your physician seeing you on regular visits. It involves a lot of lab tests. It involves ultrasounds, which is one of the most fun tests you'll ever have in your entire life. But from the patient, there's a lot of patient responsibility. It's eating correctly. It's not smoking. We used to tell people they could have moderate amounts of alcohol in pregnancy. That's now absolutely taboo. It's a zero tolerance for alcohol in pregnancy causes problems. Nobody can guarantee you your child will be perfect in life. So what you do is you do your best every moment of the time, every day of your life. And the next day, you do your best again, which is how I practice medicine. There's about 4 million deliveries a year in America right now, and 1/3 of those pregnancies have complications. They may be minor, they may be major, but you want to have a doctor and a hospital that you trust, that you can bond with, that you really feel good about. And we have that here in our hospital. If they have a high-risk condition, a medical illness, say they're on special medicine or they're under care for a heart disease or diabetes, they need to see their doctor before they even get pregnant. People who are pregnant, whether you have a healthcare condition or just a normal pregnancy, need to call their doctor as soon as they're pregnant and let them know. They'll get them in the office for a counseling visit and a checklist, making sure that everything's going okay in early pregnancy. Is there something different I should be doing? Then you'll have your first official OB visit, and that's a rather long affair. A lot of tests, exams, a one-time only pelvic exam. They only do a pelvic exam at the beginning and end of pregnancy. A lot of blood tests. There's a lot of diseases out there, and they keep inventing new diseases that we find out about that we didn't know about 10, 15 years ago that you need to be tested for. In general, in a good, healthy pregnancy, you see your doctor about every month for about 4 to 5 months. When you're about 3 months from your due date, you see the doctor about every 2 weeks. The last 4 weeks of pregnancy, you see them at least every week until you hold a beautiful baby in your arm. I wish everybody had 100% perfect, easy labor and beautiful baby. But really, life's not like that. And life's not a number either. You don't treat everybody the same. You want to give very close individual care. Use an example, a lot of my OB patients get advice from friends or relatives, and sometimes this advice is pretty good and sometimes it's kind of strange, or they get it off the internet now. And I tell my patients that, you know, we're trying to maximize and make the best baby possible. When they come in, when patients leave my office, sometimes your best questions happen at home when you're at the dinner table and there's nobody else, no doctor around there, and say, oh gosh, or somebody will tell you a story and you go, you know, I don't know if that sounds right. But I tell them, write it down. Come on in here, sit down with your doctor, talk to them, get your questions answered. I think people have better outcomes, they do better, they sleep better at night if they get their questions answered. When people are pregnant, they don't want to go to a good delivery hospital. They want to go to the best. For your own child, you don't want good, you want the very best. And I feel that's what we have. People sense that when they're here. We've had other people that have delivered at other hospitals, they come here and they said, why didn't I come here with my first baby? And then the second, third, and fourth baby, they come back here over and over again. It's funny, we have reunions with our patients. This is a very mobile society where people are always looking over their shoulder saying, is there a greener, is there something better down the road or somewhere else? And we're very blessed that people come back here over and over again.